Hey guys, it's Medicosis Perfectionalis, where medicine makes perfect sense, and today we shall continue our playlist titled Microbiology and Infectious Diseases. In video number 1, we had an introduction about medical microbiology. Video number 2 is about gram-positive, gram-negative, and the gram stain. Video number 3 was talking just about the gram-positives. Video number 4 talked about Staph aureus characteristics. Today is the 5th video discussing the diseases caused by Staph aureus. Why do you call them staph? Because they cluster together like grapes. Why do you call them aureus? Because they are golden in color. This is my playlist on microbiology and infectious diseases. Please watch these videos in order. Otherwise, you will not understand a thing. As you know, microbes are either bacteria, fungi, viruses, or parasites. Microbiology is the science that studies bacteriology, fungology, or mycology, virology, parasitology. How do we name them? Kingdom, phylum, class, order, family, genus, species. When I say Staph aureus, Staph is the genus, aureus is the species. By using gram stain under the microscope, you can classify bacteria into gram-positive or gram-negative. Gram-positive appear purple, gram-negative appear pink, for reasons discussed in video number 2. Staph aureus is a gram-positive coccus, which means spherical. Alright, you're gram-positive coccus. Now what? Let's ask a question. Are you catalase positive or catalase negative? I am Staph. I am catalase positive. Alright, what kind of staph are we talking about? We have Staph aureus. We have Staph epidermidis. We have Staph saprophyticus. Which one? How do I tell? Go to the next step. Coagulase. Ask yourself, is this bacteria coagulase positive or does it lack coagulase? Oh, I do have coagulase, of course. Congratulations, you are Staphylococcus aureus. But I do not have coagulase. Well, you could be Staph epidermidis or Staph saprophyticus. How do I tell the difference? Novobiocin. Can I kill them with novobiocin? If the answer is yes, that's Staph epidermidis. Oh, but hey, Medicosis, I gave them this antibiotic, but it could not kill them. They are resistant to novobiocin. Therefore, they were Staph saprophyticus organisms. Today, we're talking about Staph aureus, which is a gram-positive coccus, catalase positive, coagulase positive. The characteristics and the virulence factors of Staph aureus were discussed in the last video, video 4. Today we're talking about the diseases. This is how you link microbiology with internal medicine. I have prepared 18 stories for you that have something in common. Story number 1 is the story of 2 adults that came to you. Both of them have fever and a new hot murmur. The first one had history of trauma, bone pain, or severe pneumonia, and this patient was very sick today at the hospital. Conversely, the second patient has history of IV drug abuse, and he was not so sick, even though culture revealed the same freaking bacteria. What? How is that possible? Story number 2, the story of the 2 children with skin lesions, described as honey-colored crusting. Alright, this is the similarity? Yep. Here are the differences. The first kid had papules and pustules. These could be caused by one of 2 organisms, and you can treat it topically or systemically. Conversely, the second kid had, instead of papules and pustules, bullae and blisters. Maybe caused by one of 2 organisms, right? Nope, only one organism is capable of causing this. Alright, I can treat it topically or systemically. Nope, topical is not going to work. You can only treat it systemically. Patient number 3, immunocompromised, high ESR and CRP, presented with fever, new hollow systolic murmur, and chest pain. He was coughing, frank pus, and frank hemoptysis. Here's a side joke. Once upon a time, there was a pathologist. He got married and had a kid, so he named him Frank Necrosis. When we did chest x-ray to this patient, we found bilateral, multiple cavitary lesions. What's that? Story number 4, about a kid who was having fun in the hot tub and then developed these multiple, small, pinpoint, painful skin lesions. What's that? Story number 5 is about the adult with painful, red, unilateral eye nodule filled with pus. It's located at the lid margin. It's an acute inflammatory disorder caused by one of my eyelashes getting infected at the lid margin. Few days later, this nodule ruptured and burst and perforated and gave us all kinds of pus. Story 6 and 7, very similar, same bacteria. First person had acute inflammation with redness, hotness, swelling, pain, loss of function. But the second one was not red and it was not hot, it was cold. Really? Yeah. Story number 8 is about inflammation of a hair follicle. It was not treated, it spread. It got worse and worse and worse and worse and worse. Left the epidermis, went deep into the dermis, made an abscess, and raised the skin surface. It's a raised nodule sitting on top of necrotic tissue. What's that? Story 9 is about a lady. On her back there was a hair follicle infection, and then it got deeper and deeper and deeper. Forget the epidermis. Let's go deep into the dermis. Forget the dermis. I'm gonna go deep to the subcutaneous tissue underneath the skin. And then I'm gonna open deep into the abyss via multiple sinus tracts. Of course, later I can reach the blood. And then she suffered from fever, leukocytosis, tachycardia, nausea, fatigue, and drowsiness. What was that? Patient 10, never been hospitalized before. Presented with redness, hotness, swelling, pain, loss of function. It was local. We tried giving them the conventional antibiotics. They did not work. Really? Story 11, a patient with deep skin infection, plus fever, plus leukocytosis, plus tachycardia, and new acquired hypocomplementemia. He was born with normal complement level, but thanks to the infection, he's suffering from hypocomplementemia. Please name the organism and the virulence factor that caused this. Story number 12 is about a patient who's suffering from severe cough, productive sputum, and pus. But that's not the only problem. We have lung problems and skin problems, infections, redness, hotness, swelling, pain, loss of function. Cultures showed gram-positive cocci in clusters. Now you know the organisms. Can you name the virulence factor? Case 13, a kid with generalized skin peeling, skin desquamation, positive Nikolsky sign, but no inflammation, no cytolysis. What's that? Story 14, you went to a restaurant and the 3 Michelin-star chef, quote, served you lovely food. And served you were, because 4 hours later you developed severe watery diarrhea, nausea, and vomiting. It's not just you. 30 diners in the same restaurant. Symptoms resolved on their own in 24 hours. But they were severe. What did he serve me? All kinds of goodies. There were eggs, there was meat, some dairy products, some ham, some potato salads, etc. Vignette 15 is the story of the female top executive Dagny Taggart of Taggart Transcontinental. Worked her way to the top, shattering all kinds of glass ceilings. All kinds. Because she's a strong, independent woman. Respect. She cooked some tasty ham at home and brought it to the office. She's a keeper, boss. What a bunch of corporate chills. She sliced it while it was hot, refrigerated it in one plastic container. It here refers to the hog, of course. Where is he going with this? And then it was served cold next day, because there is nothing like some good, clean, cold, watery ham slices. Before discussing Q1 top-line revenue, all the accountants developed severe watery diarrhea and nausea and vomiting. Pretty sure they were following the generally accepted accounting principles, you know? She was featured on CNN Tonight after receiving her severance package. CNN anchors demanded more, quote, accountability from the HR department. Who's John Galt? Then Burger King tweeted, quote, women belong to the kitchen. People got mad, understandably. Then Burger King apologized in another tweet, women do not belong in the kitchen. There was a backlash. And then Jack Dorsey's beard tripled in size. Shut up, Medicosis. Why don't you have some respect for yourself? Yes, ma'am. Number 16, severe watery diarrhea and vomiting and cramps. Biopsy of the intestine showed us the ugly pseudomembrane. What do you mean, Medicosis? I mean, this is not a true membrane. What's a true membrane, Medicosis? The membrane that you studied in histology, the lipid bilayer membrane. Oh, so this was not the membrane that you're talking about? No, it's just a bunch of crappy inflammation, grayish plaques. That's it. There's no lipid bilayer with receptors and pumps and channels. None of this was there. It's just grayish plaque. That's what the pseudomembrane is. I can have pseudomembranous colitis. I can have pseudomembranous pharyngitis. It's the same concept. It's a grayish plaque. It's inflammation. It's not a true membrane that you possess. Okay, Medicosis, pseudomembranous colitis then. Let's test for Clostridium difficile toxin. Well, you did find a toxin, but it was not Clostridium difficile's toxin. What? Is that possible? 17. The story of the dirty inoculation. In 1928, Australian children were inoculated. The vaccine was contaminated. 21 children developed hypotension, fever, diffuse, generalized macular erythematous rash, including on the palms of the hands and the soles of the feet. Skin was desquamated, multi-organ failure. All of the organs were trashed. Some children developed purple skin lesions that measure 0.3 to 1 centimeters in diameter, and systemic blood clots all over the body, followed by bleeding from every orifice, bleeding from every wound, bleeding from every scratch imaginable. Half of the children unfortunately succumbed to their illness, 50% case mortality rate. The last story, the female neurosurgeon with menorrhagia. She's very competent. She works on brains all day long. All day long. She developed bilateral crackles, hypotension, fever, diffuse generalized macular erythematous rash with oliguria, elevated blood urea nitrogen, and creatinine. Skin desquamation was present, multi-organ afflictions, bilateral lung infiltrates. All blood cultures were negative. No one could figure out the diagnosis except the freaking OBGYN after doing a pelvic exam. What all these 18 peoples had in common was a Staph aureus infection. Why doesn't your woke professor teach like this? But to be honest, not all of the 18 patients had a problem because of the staph bacteria itself. Some of them had a problem because of a toxin produced by the staph. Oh, and that makes a difference. In order for me to find bacteria, I gotta look for the bacteria. True? Yeah. I can see the antibodies against the bacteria. I can do bacterial blood culture to find the bacteria. True. But if it's caused by a toxin, don't try to find the bacteria. You try to find the toxin. A bacteria can destroy the tissue. This is direct bacterial invasion. Or the bacteria can produce a toxin, and a toxin can cause symptoms. This is indirect. When I find gazillion bacteria in the blood, we call this bacteremia. When I find lots of toxins in the blood, it's called toxemia. In the former case, I'll find antibodies against whom? Against the bacteria. But in the latter case, I'll find antibodies against the toxin. And that's a big difference. If you want to treat the first patient, give them antibiotics. Anti-bio. Bio means living. Kill the living bacteria. Okay, can I give antibiotics to a patient with toxemia? Shut up. Bio means living. A toxin is not a living entity. It's not gonna work. Antibiotics cannot work on them. Because antibiotics are designed to target specific parts of the bacteria, not the toxin. For example, an antibiotic can target the bacterial cell wall, the bacterial cell membrane, the bacterial protein synthesis capabilities. None of these are present in a freaking toxin. So be careful and get your head out of your sphincter. Can you give me examples of diseases caused by the bacteria Staph aureus itself? Sure, you want bacteria, not toxin. Yep, I want just the bacteria. Skin infections. Like what? Oh, ready? When they are so tiny and multiple and pinpoint and painful lesions, like the kid who was swimming in a hot tub, this is folliculitis. Bigger, abscess, even bigger and hair follicle, furuncle, bigger and deeper with multiple sinus tracts, carbuncle, some brown honey crusting on the skin, impetigo. Folliculitis, abscess, furuncle, carbuncle, impetigo. Folliculitis, abscess, furuncle, carbuncle, impetigo. All of these can be caused by staph. Moreover, septic arthritis, osteomyelitis. Osteomyelitis, osteo means bone, myelo means the core of the bone, i.e. the bone marrow. And of course, if I have bone infection, it can go to the joints, causing septic arthritis. What else? Endocarditis in the endocardium and the valves. Pneumonia, empyema, not to be confused with pyemia. Empyema is some dirty pus in a cavity. It could be plural empyema, for example, if I have collection of pus in my pleural cavity. And the infection can go to the brain, causing brain abscess. Or staph can produce some toxins that cause symptoms. Examples of these diseases include staphylococcal scalded skin syndrome, toxic shock syndrome, and food poisoning. Try to look for the toxin, do not give antibiotics. SSSS is the story of the kid with generalized skin peeling and skin desquamation, positive Nikolsky sign, no inflammation, no cytolysis. Toxic shock syndrome is the female neurosurgeon. She's standing all day. Oh, she forgot to change the tampon because the freaking neurosurgery took 13 hours. Don't blame her. She was trying to help the patient. And then the toxins left the vaginal canal, went into the blood, toxemia, causing all kinds of systemic symptoms. When the doofuses cultured the blood, they found nothing because it's a toxemia, it's not a bacteremia. The only one who diagnosed her was the OBGYN after taking good history and physical exam. Staph food poisoning is the story of the 3 Michelin-starred chef and the story of Dagny Taggart of Taggart Transcontinental. If you saw Atlas, the giant who holds the world on his shoulders, if you saw that he stood, blood running down his chest, his knees buckling, his arms trembling, but still trying to hold the world aloft with the last of his strength, and the greater his effort, the heavier the world bore down upon his shoulders, what would you tell him?
I don't know. What could he do? What would you tell him?
To shrug. Let's talk about the skin infections caused by Staph aureus. We talked about this before. Remember, Staph is coagulase positive, unlike Strep, which was coagulase negative. Why is this significant? Because Staph, coagulase positive, therefore capable of converting fibrinogen to fibrin. That's what coagulase does. And that's why Staph will be localized in a narrow area. It will not spread because of fibrin. Fibrin makes a clot. A clot keeps us in place. So I'll have folliculitis, abscess, furuncle, at the very least carbuncle, but I'm not getting bigger than this. Why? Because I have coagulase. And I'm being kept in check. I am a well-confined lesion. Conversely, Strep is coagulase negative. No one is going to stop it. It's going to spread. Sepsis, cellulitis, necrotizing fasciitis. These are wide, diffuse lesions. How about impetigo? Well, if you're talking about the non-bullous impetigo, this could be caused by Staph or Strep. But if you're talking about bullous impetigo with bullae and blisters, this is Staph only. How do we treat Staph? Ox, clox, diclox, and naf. Give naf for Staph. So for Staph, ox, clox, diclox, and naf. Oxacillin, cloxacillin, dicloxacillin, nafacillin. Staphylococcal skin infections. Staph is coagulase positive, therefore I'm going to convert fibrinogen to fibrin, therefore I'm going to be confined and localized in a certain area. The kid swimming in a hot tub folliculitis. What the flip is a follicle? This is your hair follicle. Okay, it's a pyogenic infection? Yeah, because Staph is a pus-producing organism.
Okay,
let's make this bigger. Now it's called furuncle. Painful raised lesion on necrotic tissue. It's an extension of the folliculitis. Furuncle has another name, boil. Let's take multiple furuncles and make them coalesce together and push deeper. Congratulations, you have become carbuncle. Not just epidermis, dermis too. Not just skin, subcutaneous too. Oh, especially on the back and the back of the neck, and with multiple sinus tracts that dig deep into the abyss. Let's dig deeper. Now you are in a blood vessel. Now you have bacteremia, Staph aureus all over your body. Can I culture it? Of course you can culture it. It will give you a positive result. This is bacteremia. This is not toxemia. What else can happen? Those ugly bacteria can send septic emboli to the blood, and this is what we call pyemia. A doofus student will define pyemia like this.
Oh, Medicosis, I know it. It's easy. Pyemia, pyo means pus and emia means blood. Therefore, pyemia is pus floating in the blood.
Doofus, stupid. There is no such thing in the history of humans as pus floating in the blood. It's impossible. What's floating in the blood is a septic embolus. A septic focus made a septic embolus. The septic embolus is floating in the blood. A bunch of bacteria, not pus. Once the septic embolus reaches the target organ, it can cause pus in the target organ. Not pus floating in the blood. There is no such thing. Get your head out of your sphincter. So what caused pyemia in cases of staph infection? It could be an abscess in the skin, lung, and brain that spread by means of septic embolus. Or it could be a wound infection, usually after a trauma. Why? It's contaminated, dirt, band-aid, etc. Conversely, surgical wounds should be cleaner than traumatic wounds. But nothing is 100% clean. I can get pyemia too, and then the septic embolus is in the blood until it reaches the target organ. If the target organ is the heart, congratulations, you have acute bacterial endocarditis, which affects the endocardium, which is the inner lining of the heart, which includes the heart valves. But if the target was the lung, I can go to the lung tissue, causing lung abscess. I can go to the pleural cavity, causing empyema. If the target organ was the brain, I can lead to cerebral abscesses, among other infections. Staph is pyogenic. Staph makes pus. What are the pus cells? Neutrophils. Those are the ones who make the pus for you. Staph just happened to trigger them. Neutrophils are also the cells of acute inflammation, therefore you'll have redness, hotness, swelling, pain, loss of function. But if you're immunocompromised, you cannot cause redness, hotness, swelling, pain, loss of function. This requires some immune cells. If you're immunocompromised, you get a cold abscess. Pause and review. Now let's talk about staph endocarditis. Before we talk about staph endocarditis, let's talk about bacterial endocarditis in general. What's that? Endocarditis. Itis means inflammation. Cardi is the heart. Endo is the endocardium of the heart, which includes the cardiac valves. All of these patients will suffer from fever and a brand new murmur that did not exist in me before. Bacterial endocarditis could be acute or subacute. In acute endocarditis, there is a strong bacteria invading and destroying a strong, healthy valve. But in subacute, it's a weak bacteria. The only reason the weak bacteria was able to destroy you is that you had a valve that was weakened before that. So strong bacteria on a strong valve is acute endocarditis. Weak bacteria on a weak valve is a subacute endocarditis. Example of organisms causing acute: Staph aureus, of course. Why? It's a very strong bacteria. Can it destroy my strong valve? Yes, it can. How about subacute? The Haysick group of bacteria. You have Haemophilus aggregati, Bacter cardio, Bacter echinella, Kignella.
Hey, Medicosis, I've never heard of them before.
Yes, that's the point. These are weak bacteria. The reason you've never heard of them before is that they are unlikely to infect you because you have healthy valves. When it comes to staph, we're talking about strong bacteria destroying a strong, healthy valve. High virulence organism, this is staph, on an intact, healthy heart valve, causing endocarditis. Patient's going to complain of fever. The doctor will hear a new murmur that did not exist before. That's why patient history and patient's records are important.
Why did I get endocarditis?
It's because of pyemia. Oh, so there is an original source of infection sending septic emboli down the bloodstream, down the highway until I reach the heart? True. If you remember the first case that we discussed today, we had two adults. Both of them had fever. No murmur, same bacteria. One of them had very severe symptoms. One of them had mild symptoms. The person that had the mild symptoms was the IV drug user. Why not so sick? Because when I inject a drug IV, it's going to go to the venous system, to the SVC and IVC, superior vena cava and inferior vena cava, to the right side of the heart. Yes, an infection in the right side of the heart is bad, but it's not as bad as an infection in the left side of the heart. That's why it's less evil than the bacteremia caused by trauma, osteomyelitis, complicated severe pneumonia that spread, etc. Now let's talk about spread.
Are you talking about some peanut butter spread?
No, staph spread. I can spread to the lung, causing pneumonia, lung abscess, and in the pleural cavity I cause empyema with loculated pleural effusion. Thick. Is this an exudative effusion or a transudative effusion? Of course it's an exudate. This is an infection.
You mean increased capillary permeability and the like?
True. The patient will suffer from cough that is not dry, it is wet and productive of frank pus, maybe frank hemoptysis, maybe necrotizing pneumonia. Diagnosis: chest x-ray, chest CT scan, sputum sample, sputum culture. Since this bacteria is in the blood already, you can do blood culture. Treatment is antibiotics, of course.
Staph is in my brain,
causing brain abscess, causing encephalitis, causing meningitis. Brain abscess is a collection of pus in the brain. It's a mass. It's a mass lesion, which can raise my intracranial pressure, giving me classic symptoms of intracranial hypertension, including morning headache, that is frontal, that gets worse as I lean forwards, as well as projectile vomiting, as well as cranial nerve abnormalities. These are called focal neurological symptoms. Can this lead to focal seizure? Absolutely true. If you do lumbar puncture, you'll find increased opening pressure because there is too much pressure. But I do not recommend that you actually do a lumbar puncture. Whenever there is a mass in the brain, be careful because if you do a puncture, you can herniate. What's the definition of encephalitis? Inflammation of the brain tissue itself. What's the definition of meningitis? Inflammation of the coverings around the brain, not in the brain itself. No, these are the coverings that surround the brain, and they include pia mater, arachnoid mater, and dura mater. Ready for an exam question? This could be asked. Here's a patient that has history of severe skin infection, or severe pneumonia, or severe trauma, or severe acute bacterial endocarditis, and then the patient developed fever, focal neurological symptoms, which include morning frontal headache that gets worse as I lean forwards, projectile vomiting, papilledema on fundoscopic exam, and increased opening pressure on lumbar puncture, and they also had focal seizure in the left arm. The left arm is shaking, the rest of the body is not shaking, unless you're talking about some shaking chills. Diagnosis, cerebral abscess. This is classic. The reason why brain abscess cause all of these symptoms was discussed before, and it has to do with physics. Next, let's infect the bone marrow, and the joints. Osteomyelitis. Osteo means bone. Myelo means core. In this case, it's the core of the bone, which is the bone marrow. Oh, myelo means core? Yeah. For example, we have myelodysplastic syndrome. We have myelophthisis. Oh yeah, because the bone marrow is in the core of the bone. Moreover, the spinal cord can be called myelo because the spinal cord is in the core of your vertebral canal. Oh, that makes sense. And that's why we have syringomyelia, poliomyelitis, transverse myelitis. It actually makes sense. Staph went to the blood. Septic embolization? Absolutely. And then before you know it, it's in the bone. Or it could be a direct infection if someone hits me with a sword or with a dirty gunshot wound that went directly into the bone. So it could be direct spread or distant spread. Regardless, staph is gonna end up in the metaphysis. Why not the epiphysis? Because the cartilage is gonna stop it. I cannot reach the epiphysis when there's a cartilage in the way.
Okay, why not the diaphysis?
The diaphysis is a very open area. The metaphysis is closed, sluggish. Whenever you see sluggish circulation, it is called stagnation. Whenever you see stagnation, bacteria are going to show up. Inflammation of the bone, exudative effusion, lots of pus, eventually necrosis with increased intraosseous pressure.
It is really painful.
Why did I get osteomyelitis? Could be direct spread or hematogenous spread. From an abscess, for example? Absolutely. From a tooth infection? Why not? From endocarditis? Yup. Then I'm going to land at the metaphysis. And I'm gonna spread. I'm gonna raise the periosteum and create a subperiosteal abscess, forming the classic sequestrum on the inside, involucrum on the outside. And they look like this. Who's the one on the outside? Involucrum. Who's the one deep to the inside? Sequestrum. And what are you sequestering? Some necrotic tissue that can open with a sinus tract, opening between the bone and the outside world. That's a sinus. So now you heard of two sinuses in this lecture. The first sinus was that of carbuncle, multiple sinus tracts on my back. And the second sinus is here. It's a sinus in the bone, secondary to osteomyelitis, secondary to bacterial invasion. Complications of osteomyelitis. This is infection of bone and bone marrow. Bones are related to joints. They are very close. Therefore, septic arthritis, inflammation of joints. Say goodbye to my bone. Fractures, spread of infection, septicemia, pyemia. Don't say pus in the blood. It's just a septic embolus in the blood, made of staph, of course. Can I go to the vertebra? Yes, and this is called vertebral osteomyelitis. Very dangerous. It can fracture the vertebra, collapse you, compresses the cord, causing myelopathy and radiculopathy. Myelopathy is when you destroy the spinal cord itself. Radiculopathy is when you destroy the spinal nerves as they are exiting from the spinal cord.
I suspect that my patient had septic joint, a septic knee. What should I do?
You should tap the joint, aspire the joint. What would I find? Purulent picture. What do you mean? Lots of fluid in the knee. The clarity, it's not clear, it's opaque. Lots of gunk is there. Color, yellow to green. Lots of pus, baby. Why green? Neutrophils. Let's measure the white blood cells. More than 100,000 per microliter. How about my neutrophils? More than 75% of the 100,000 is made of neutrophils.
Oh, it's an acute infection.
True.
It's an acute bacterial infection.
Also true. When you culture that fluid, you will see the Staph aureus smiling at you. All of the above were diseases caused by the bacteria itself. Now let's talk about the toxins. When staph secretes toxins, it can lead to staph scalded skin syndrome, toxic shock syndrome, food poisoning. Let's talk about SSSS. Here's a kid with skin peeling, skin desquamation, positive Nikolsky sign, which means when you touch the baby's skin, the skin peels off.
Really?
Just with mild pressure? Yeah, that's a positive Nikolsky. That's not good.
Why did the baby suffer from this?
Because of an exfoliative toxin released by the staph. And we have two types, exfoliative toxin A, and guess what? Exfoliative toxin B. The kid has peeling and desquamation, bully and blisters, no inflammation, no cytolysis, no bacteria, no leukocytosis inside the lesion.
Why not?
Because the disease is caused by the toxin, not by the bacteria. Get your head out of your blister. What's the prognosis? It's probably gonna heal in 7 to 10 days, leaving no scarring, no fibrosis. Oh, that's clean. Mortality rate in kids is 2%, but in adults is 60% because most of the patients in this situation will be immunocompromised. Your exam question will describe a baby with perioral erythema, redness around the mouth. 2 days later, it spreads to the entire body. All of the skin is peeling and desquamating, bully and blisters, no inflammation, no cytolysis. When you biopsy the lesion, no bacteria, no leukocytosis. When you leave it for 7 to 10 days, it heals, leaving no scarring, no fibrosis. Name the bacteria staph. Did the bacteria cause it? No, it was the toxin. Name the toxin. Exfoliative toxin A and exfoliative toxin B. Impetigo comes in two forms, non-bullous impetigo or bullous impetigo. Non-bullous could be staph or strep. Bullous impetigo, only staph. It has lots of bully. It's localized, the erythema does not extend, Nikolsky is not present, and it's not treated by topical antibiotics. You have to give systemic ones like oral antibiotics.
Coming up next,
Staph food poisoning. This is the story of going to the dirty restaurant, eating dirty food, which contained not the staph, but the staph toxin. What kind of toxin? Enterotoxin. And we have two types of these, enterotoxin A and enterotoxin B. Enterotoxin A is the one that gave me watery diarrhea. Enterotoxin B is the bacterial staph pseudomembranous colitis. Tell me about toxin A, watery diarrhea after eating potato salad, ham, salted pork, lots of desserts like banana pudding, custard, pastries, ice cream, eggs produce salad, don't forget potato salad, dairy and meat. Symptoms began to show up after 4 hours of eating from the dirty restaurant. They resolved on their own within 24 hours, but make no mistake about it, it was severe bout of gastroenteritis. You diagnose it clinically, you treat symptomatically. If the patient needs fluid, give the patient fluids, normal saline. If the patient is in severe pain, give non-steroidals.
Should I give antibiotics?
Shut up. This was caused by the toxin, not by the bacteria. Next, enterotoxin B. Think bowel. Think colitis, pseudomembranous colitis this is. Rule out C. diff colitis because this is ugly and more common. After you rule out Clostridium difficile, test for staph toxin, you will find enterotoxin B smiling at you from the patient's poop.
Hey Medicosis, if I reheat this food, will I kill the bacteria?
You will kill the bacteria, but you will not kill the toxin. It's a heat-stable toxin, therefore you will still get sick. If you want to prevent this, you cook your food, you eat it fresh. Don't leave it at warm temperature for a long time, because now you're giving time to the ugly staph to produce tons of enterotoxin A.
Why did the 3 Michelin star chef give me gastroenteritis?
Because if you remember the case, the chef was picking his nose. His nose is colonized by Staph aureus. That's not peculiar to that chef. 15% of the population have staph in their mucosa. That's not a big deal. But once I get my finger out of my nose and touch your food, the toxin is on your plate. Then the government and Michelin Incorporated demanded that their chefs be kept to a, quote, higher standard. So they ordered and demanded that every chef wears gloves while preparing the food. So the chef inserted a gloved finger into his nose and added Staph aureus to your plate. When you see Atlas carrying the whole world on his shoulder, what would you tell him? To shrug. Next, let's talk about toxic shock syndrome. Toxic shock syndrome can happen because of a tampon that's left there and not changed regularly, or by wound infection or by contaminated injection. Do you remember my competent female neurosurgeon? Yep. Tampons or pads, especially if they are hyperabsorbent. So this is nothing to brag about in your commercials. You hear me, Procter & Gamble? Pun. This channel is not gonna last for long. This can happen to a menstruating female or in the postpartum period because of the presence of lots of blood and the use of many pads. Wound infection, contaminated injection. Do you remember the story of the Australian babies? Yep, it was a contaminated injection, adding toxic shock syndrome toxin 1 to my blood. It was not caused by the staph. It was caused by the staph toxin, known as toxic shock syndrome toxin number 1. I can't even say it. Symptoms of toxic shock syndrome. Well, it's a shock, hypotension. The definition of shock is inadequate tissue perfusion. Fever, diffuse, generalized, macular, red rash, including the palms of the hand and the soles of the feet. Skin desquamation, multi-organ failure, and then it can get worse. Purpura fulminans. What's that? Basically DIC. What's the purpura? You know purpura, right? Dark purplish skin lesions. Oh, and they measure 0.3 to 1 centimeters in diameter. So can you tell me about 2 causes of purpura fulminans? Cause number 1, toxic shock syndrome toxin 1, which is toxic shock syndrome. How about the second cause? Neisseria meningitidis. It can also lead to DIC and purpura fulminans. What are the diseases that cause fever and rash, including the palms of the hand and the soles of the feet? Here is a list. You need to memorize this. And as you see, toxic shock syndrome is here. Pause and review. The story of the Australian children is a story of toxic shock syndrome, toxin number 1, causing toxic shock syndrome, complicated with purpura fulminans ending in DIC, bleeding from every orifice, with decreased platelet count, prolonged bleeding time, prolonged PT and PTT and TT, decreased fibrinogen, elevated D-dimer, increased fibrin degradation products. The story of the virulence factors of Staph aureus were discussed in the last video. Don't forget, here is my enterotoxins for gastroenteritis and pseudomembranous colitis. Here is toxic shock syndrome toxin number 1 for toxic shock syndrome. Here is the exfoliative toxin causing Staphylococcus Scalded skin syndrome with desquamation in a baby. Protein A arrests the antibodies, making a complex consuming my complement, leading to hypocomplementemia. And don't forget that staph is coagulase positive, ergo folliculitis, abscess, furuncle, at the very most carbuncle, but less likely to cause sepsis, cellulitis, necrotizing fasciitis. Compare and contrast between Reiter syndrome with 2 T's, this is staph scalded skin syndrome, and Reiter syndrome with A followed by I. This is now called reactive arthritis, which is a triad of can't pee, can't see, can't climb a tree. Let's review today's vignettes. Case number 1, 2 adults with fever and no murmur. Both of them have acute bacterial endocarditis. Why is this one less sick? Because it's a venous thing. It goes to the right side of the heart. But in this case, it goes right and left. 2 children with skin lesion, honey-colored crusting. Both had impetigo. The first one had non-bullous impetigo, could be staph or strep. Papules and pustules, you treat it topically or orally. But bullous impetigo, we're talking bully and blisters, only by Staph aureus, only treated systemically. Case number 3, immunocompromised, fever and no murmur, cough. What's all of this? All of this is Staph aureus. It's a severe disease if you're immunocompromised. I can get endocarditis and cavitary pneumonia. This kid had hot tub folliculitis, pinpoint multiple lesions. They are painful. 5. This adult had hordeolum or a sty. This is the folliculitis of the eyelid. Take one of the hair follicles, it got infected, and now you have this nodule on the eyelid filled with pus, gonna perforate, discharging the pus. 6 and 7 are just staph skin infection. If I am immunocompetent, I get the hot abscess. If I'm immunocompromised, I get the cold abscess. Cardinal signs of inflammation? No cardinal signs of inflammation because I have weak immunity. I cannot perform inflammation. What's that? Furuncle, which is a complication of folliculitis. Then when it gets deeper and keeps pushing into the subcutaneous tissue with multiple sinus tracts, that's carbuncle. Some days later, it can lead to bacteremia. Why didn't the skin infection respond to conventional antibiotics? Because this was MRSA. But the patient has never been hospitalized. Yes, nowadays MRSA is prevalent even in the community. It's no longer peculiar to a hospital setting.
Why did this patient have bacteremia and hypocomplementemia?
It was caused by protein A, which belongs to staph. It's one of the virulence factors, triggering an antigen-antibody complex, activating and then consuming all of my complement. I ended up with hypocomplementemia. Severe lung infection and skin infection. This is classic Staph aureus. Which virulence factor? The answer is cytotoxins. There is cytotoxin alpha, beta cytotoxin, gamma cytotoxin, delta cytotoxin, and PV cytotoxin. Please refer to the previous video. What's that, kid? This is staph scalded skin syndrome. 14. Staph gastroenteritis, enterotoxin A. Also enterotoxin A, causing staph food poisoning. This is staph enterocolitis. It was C. diff negative but positive for the toxin of staph. Which toxin? Enterotoxin B. The dirty inoculation, toxic shock syndrome with purpura fulminans. The female neurosurgeon, also toxic shock syndrome. Quiz time. Here's question 1. Here is question 2. Here are topics for you to review. The answers to the previous questions will be posted in the next video in this playlist called Microbiology and Infectious Diseases. Let's review Staph aureus from Picmonic. Staph aureus. Here's a staph, here is Oreo. Oh, Staph aureus. Yep. We are gram positive. Here's an angel. We are cocci, circular, spherical eyes. I am catalase positive, the positive cat. I am coagulase positive, the positive clog. Beta hemolytic, here's a beta fish. Protein A is a virulence factor, which inhibits phagocytosis. Here's a macrophage being inhibited. MRSA is getting more common. MRSA is resistant to many antibiotics. Now let's talk about the diseases caused by staph. Skin infections can happen. Impetigo with honey crusting can happen. Bone infections and osteomyelitis, pneumonia, endocarditis, and don't forget my toxins, which can lead to toxic shock syndrome and Staphylococcus Scalded skin syndrome. And don't forget my food poisoning. Here's everything you need to know about staph diseases. Virulence factors are here. Staph aureus diseases are here. Some by the bacteria, some by the toxins. Pause and review.
Hey Medicosis, this was a fabulous lecture. Why can't my professors teach like this?
Maybe they suffer from staph infection. After watching this video, it makes perfect sense to get my antibiotics course from my website to learn about the antibacterials, antivirals, antifungals, and antiparasitic medications. How many types of penicillin do we have? What's the difference between penicillin and cephalosporins? How about the generations of cephalosporins? When should I use the first generation? When should I use the third generation? Etc. All of this is discussed at medicosisperfectionalis.com. Speaking of toxemia, you can also download my toxicology course at medicosisperfectionalis.com. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my courses. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.